many times do you brush your teeth in a day? Do you floss? If you do, how often do you do it? Hello and welcome back to Time with Lydia, the pharmacist. Today I'm going to be sharing with you some tips that can help you maintain a good oral hygiene. A good oral hygiene is essential to prevent a bad mouth smell. To maintain a good oral hygiene, follow these simple steps to avoid a bad mouth smell. Number 1, brush your teeth twice a day, one occasion being last thing at night with a fluoride-containing toothpaste. Good brushing technique is paramount to good oral hygiene, as it is important to remove plaque from all corners around the teeth and gum. Do you know about electric toothbrushes? Electric toothbrushes have been shown through research to be the best and most effective at removing plaque from the mouth. And the best one to choose is the one that rotates in both directions. Everyone can use an electric toothbrush, but they are particularly useful for people with limited movement of the hand or arm, such as disabled or elderly, who often find that using a normal toothbrush does not allow them to clean thoroughly. Electric toothbrushes can also be better for children, as they may be more likely to brush regularly because of the novelty of using an electric toothbrush. One important thing is to remember to change your toothbrush or the brush head every 2 to 3 months, as the bristles of the toothbrush wear out with use and can become less effective. Do note that it is always good to use a soft-bristled toothbrush with a small to medium brush head to reduce damage to your tooth enamel. Point number 2, and this is a very interesting one. Whilst we were growing up, we were taught to rinse our mouth with water after brushing. And even when you want to use a mouthwash, you've got to rinse your mouth first before you use the mouthwash. And I got to know this whilst I was researching. Did you know that after brushing, you don't have to rinse your mouth? All you need to do is spit out the toothpaste and you're good to go. And if you have to use a mouthwash, you need to wait for some time, because what happens is when you use the mouthwash, it gets rid of all the fluoride from the toothpaste from your mouth, and this prevents the fluoride from doing its job in your mouth. So after brushing, spit out the toothpaste. Do not rinse your mouth or use a mouthwash immediately. Point number 3, floss every day. Do you floss at all? If you don't, then get flossing into your daily routine. Flossing or incidental brushing is a vital part of oral hygiene, as it helps remove plaque and food particles from between the teeth. Flossing correctly is also very effective at removing plaque from under the gum line, which is often missed with brushing alone. When you have to floss, stand in front of the mirror so you can see what you're doing. And research shows that both the tape and incidental brush have similar benefits when used on a daily basis. So use the one that you are comfortable with. Number 4, remember to clean your tongue as well, because food particles do get stuck on our tongue. So you can get a special tongue scraper to use every time you brush your teeth. And point number 5, use a mouthwash. Mouthwashes are useful for reaching areas of the mouth that you miss by brushing and flossing. There are different types of mouthwashes, so speak to your community pharmacist and they would prescribe the appropriate one for you. Tip number 6, and this is very important, is eating healthy and avoiding sugary foods. And tip number 7 for maintaining a good oral hygiene: stop smoking if you do. If you're finding it difficult to stop smoking by yourself, there's so many options available. All you need to do is visit your community pharmacy and have a chat with your community pharmacist. There's nicotine replacement products that you can purchase from your local pharmacy, and these are very effective at helping you stop smoking. And last but not the least, tip number 8, have regular dental checkups. When was the last time you had a dental checkup? Have you even had one before? Please do make an appointment if you've not had one recently. We are all required to have a dental checkup at least once a year. And if you've got any condition in your mouth, then at least twice a year is advisable. You know, dental checkups are important as they allow the dentist to monitor the health of a person's mouth. Attending regular dental checkups helps to detect problems at an early stage and allow prompt treatment if necessary. You know, when you maintain a good oral hygiene, you feel confident in yourself, you avoid a bad mouth smell, which can prevent people from coming close to you. A bad mouth smell is one that people would not tell you when you have it. They will just shun your company, and this is what you want to avoid. It takes some confidence for someone to come close to you and tell you that you have a bad mouth smell. So please follow these steps and they would help you maintain a good oral hygiene so as to avoid a bad mouth smell. Thank you once again for your time today. Please give this video a thumbs up, share with your family and friends, and if you haven't yet subscribed to this channel, I don't know what you're waiting for. Subscription is free. Please hit on that subscribe button and also on the notification bell so you don't miss any of my videos. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.